Good afternoon, and thank you for joining us for this community briefing on COVID-19. Joining us once again is interpreter Margie Propp, and thank you, Margie, for providing your services to make this briefing more accessible. To keep one another safe and to access information and resources that are available to support our community throughout this pandemic, we encourage everyone to visit our website at covid19.lincoln.ne.gov. There you will find a dashboard with the latest COVID-19 data, and we update that dashboard daily at about this time. At our website, you will also find the COVID-19 Risk Dial, which is a color-coded tool that gives our residents an understanding of the risk level for transmission of COVID-19 in Lincoln and Lancaster County. We update the dial every Friday, and for the third week in a row, we will remain in the low orange section of the dial, indicating a high risk of the virus's spread in our community. As students return to classrooms, it's important that we remind our children of the basic steps that they can take to keep themselves, their friends, and their families safe, wearing masks, washing their hands, and watching their distance. School is a wonderful place for learning and growth, and we know how the lessons they learn will affect the rest of their lives. Let's ensure that students are safe and that one of their lessons this year includes cultivating even greater compassion for one another by wearing masks to keep one another safe. In today's situational update, an additional 16 individuals in Lincoln and Lancaster County have tested positive for COVID-19. That's the lowest number of daily cases since July 6th. The total number of lab-confirmed cases now stands at 3,431, and our total recoveries identified to date are up from 1,518 to 1,591. Health Director Pat Lopez is here with a look at the main indicators that have determined the position on our COVID-19 risk dial.
Thank you, Mayor. Since the inception of the COVID-19 risk dial in May, the Health Department has used 5 primary measures to determine the risk of the virus in our community. The first measure is the number of new cases. We went from a high of 360 new cases for the week ending July 25th down to 207 cases for the week ending August 8th. That's a 43% decline in weekly cases. As of today, we have seen even fewer cases for the current week, with 131 to date, and we have 2 more days to go in our current week. A second factor is the positivity rate over the past 3 weeks. The positivity rate can help identify risk even when testing or the number of new cases are fluctuating up and down. The average weekly positivity rate has been trending down and is now beginning to level off. We went from a high of 8.3% the week ending July 25th to 6% the week ending August 8th. This week, so far, we are close to 6%. Testing continues to be widely available in the community at the 3 drive-in sites. Appointments are required, and the process begins with a simple assessment at bryanhealth.com, chihealth.com, or testnebraska.com. Test Nebraska is free, and there is no billing to insurance. Over 51,000 Lancaster County residents have now been tested. We have been seeing about 4,000 tests completed each week, but last week that was down to about 3,500. So far this week, about 2,000 people have been tested. We don't have a full picture of why fewer people are being tested. One factor could be that through our contact tracing, we are seeing fewer people being considered close contacts because they are wearing face covering. That means fewer people are being recommended for testing. We will continue to watch this trend by watching testing closely and any impact this has moving forward. We have been happy to see some improvement in the turnaround time to receive test results. 76% of testing results are now being received within 3 days or less. However, Quest Lab, that does tests for places such as CVS and others, is averaging from 8 to 10 days, and as long as 2 weeks to get results for those tests in Lincoln. This is unacceptable. It can lead to people spreading the virus because they don't know the results. As we've noted before, delays in receiving lab results does impact how soon we can follow up with those who have been tested positive and begin the contact tracing. The health department continues to have sufficient contact tracers to keep up with the demand for investigations. Nursing staff initiate contact attempts to reach out to positive cases within 24 hours of receiving the lab results. Over the past 3 weeks, over 90% of all positive test investigations were completed in this time frame. We want to again remind the public, if you are sick, stay home. If you have a positive test, you must self-isolate. If you've been tested and are waiting for results, you also need to stay home until you receive those results to avoid potentially exposing others. And if you have a known exposure or close contact with a person who has tested positive for COVID-19, you need to self-quarantine. The final key factor we evaluate in determining our community's risk is the capacity of our hospitals and the strength of our entire healthcare system. The use of ICU beds and ventilators has been fairly steady, but local hospitals have reported an increase in the overall number of beds used in the past 3 weeks. Again, this is the overall number, not just the number of COVID-19 related patients. We also want to note that we are seeing an increase in patients who are suspected to have COVID-19 and have been tested but are awaiting results. This is due to the limited availability of rapid testing. Over the past 3 weeks, we've seen an average of about 5 patients a day who are waiting for their results. Over the last few days, the daily average has gone up to about 11. Today, Lincoln hospitals report 15 COVID positive patients, with 6 Lancaster County residents and 9 from other communities. Many of the key indicators continue to be level or show improvement. We are on the brink of going from orange or high risk on the COVID-19 risk dial to yellow, indicating moderate risk. This map shows how close we are to yellow. You can see the metrics plotted on the color gradient graph. We average all these risk factors to determine the dial position. If you draw a diagonal line from the upper left-hand corner straight to the bottom right-hand corner, this divides the upper section of orange and red, high and severe risk, and the lower section of yellow and green, moderate and low risk. Toward the bottom left, testing availability is near green. In the middle, the point represents the weekly positivity rate and the number of new cases, average testing turnaround time, and contact tracing. All are on the edge of yellow and orange. Closer to the upper right-hand corner, you will see the measures that include contacted cases, average daily hospitalizations, and community spread. These are all in the orange. Finally, you will note the blue square outlined in red at the middle of the gradient map. It is on the very edge of low orange and upper yellow. It is the result of averaging all the metrics together, or where the dial is currently located, just barely in orange and very close to yellow, or moderate risk. By using multiple measures and considering any unique situations for Lancaster County each week, we believe the analysis provides the most robust description of local risk to the public. As a reminder, a summary of the COVID risk dial metrics can be found with the dial on the covid19.lincoln.ne.gov site. To get back to the yellow or moderate risk area, we all need to continue to be diligent in protecting ourselves and others. We need to keep wearing face coverings, staying at least 6 feet from others, and washing our hands regularly. The need for these measures will not be going away anytime soon, and these steps are keys to moving forward and preventing new clusters and outbreaks. As the mayor said, this is more important than ever to protect the students, teachers, and staff at our local schools and universities.
Thank you, Director Lopez. To conclude the briefing, we'd like to thank everyone who is wearing a mask in our community and to highlight what you have helped us accomplish here in Lincoln and Lancaster County. After 3 weeks of a mask requirement, we can now say with evidence that it's working. Our COVID-19 case numbers significantly declined week over week since our community began to follow the mask requirement on July 20th. Here's a visual illustration that proves the point. The data on this chart shows that the implementation of the directed health measure that included the face covering mandate on July 20th has contributed to the improvement in our numbers that we've experienced here in Lincoln. When we look at the 7-day rolling average of new cases over the last 3 weeks, we can clearly see the decline in new cases from an average of 55 back at the end of July, close to July 25th, down to below 30 all of this current week. The star on the, and there's an arrow there that also shows where the face covering mandate went into effect. Our local data and the positive trends we've shared with you today support scientific research that tells us universal mask wearing can significantly slow the spread of the virus. According to a University of Washington Institute for Health Metrics and Evaluation meta-analysis of mask usage around the world, if 95% of people wear cloth masks when they're out and about and interacting with other people, it reduces transmission by at least 30%. In other words, if each infected person will go on to infect 30% fewer people. And with a virus that spreads exponentially, a 30% reduction in transmission can massively reduce the cumulative impact on a community in terms of our health and our economy. Again, these tantalizing results are what's possible if masks are universally utilized. And while I'm so proud of what Lincolnites are accomplishing thus far by wearing masks, I am further heartened by the prospect of Omahans joining forces with us in this fight against COVID-19. I would like to extend my deepest appreciation to both the Douglas County Board of Health and the Omaha City Council for taking the impressive step of unanimously voting in favor of a mask requirement in their community. Given the proximity of our two cities and the amount of interaction typically occurring between us, we in Lincoln are safer with Omaha having a mask requirement in place. Thank you, Omaha. We are stronger and safer as we navigate the pandemic in masks together. These steps we are taking to protect ourselves, our family members, our neighbors, and our fellow Nebraskans are helping us be greater than this virus. By wearing masks, washing our hands, and watching our distance from others, we are demonstrating our collective power over a pathogen. Let's remain unified in these efforts. They are the key to successfully and safely opening our schools, rebuilding our economy, and resuming a more familiar way of life. And with that, we'd be happy to open it up for Q&A from the media. I'll bring Director Lopez up for that.
State taking any sort of action to try and correct that problem? It sounds like that's going to work against your efforts to isolate cases or contact tracing.
Absolutely, and we've been in discussion with the governor and his team over the last few weeks about this, and we're working together to try to, influence better testing turnaround times coming out of Quest. Obviously, our attempts to do effective contact tracing depend on those results coming back quickly. As you can imagine, someone who gets a test has to quarantine until they get their test results, and if that means waiting 7 to 10 days at home, that's 7 to 10 days of missed work, of restrictions that could be avoided if those lab results came back more quickly. And frankly, if you wait that long, you lose vital time needed to contact those who may have been exposed by the person if they come back with a positive test. So the whole effort is broken down with that kind of a lengthy turnaround time. We are working together to try to direct people to the testing sources that can provide results more quickly. And we recognize, of course, that surges around the country affect all of us. When labs are being overrun by cases and the demand for testing in other communities and states across the country, that has a downstream effect on us. But we are, frankly, emphasizing the need to go to Test Nebraska. We have fewer shortages related there to key materials and are able to do faster testing there. I think Director Lopez is giving me the thumbs up that I covered it. Any other questions?
Take another one then.
Sure.
Early in the week, obviously, the health department and Madison's were able to reach a compliance plan that would get them in a position to reopen. How effective does the health department believe that has been? I know, at least online, there's in social media, there's sort of an attitude that the Madison's remains a face mask optional place.
I'll ask Director Lopez to come on up and answer your question and speak to whatever work the health team has done there. But I would encourage people not to believe everything they read or see online. And as we've said throughout this pandemic, and especially since we put the mask requirement in place, we're encouraging people to recognize that there are members of our community who will not be wearing masks owing to a health problem or to special needs, that we are trying to extend grace and compassion to those, and we're not asking people to confront each other about their reasons for wearing a mask or not. So again, there may very well be good reasons that people in images don't have them on, but I'll bring Director Lopez up to answer your question.
Good afternoon, Riley. We expect Madison to comply with the plan that they put in place, and we have no reason at this point in time to think that they aren't. And we will be continuing to do surveillance as we do with all of the bars in Lincoln, all the bars and restaurants, and we'll continue to do our restaurant inspections as we always have. We know that some areas through surveillance that Longwell's has been compliant, and the rail yard and other areas. So we expect Matson's to be compliant. And as the mayor pointed out, it's hard to say who has a health problem and can't wear a face covering or mask.
Director, as a follow-up to that, complaints since Tuesday about Madison specifically?
Since Tuesday, I'm not aware of any about Matson's.
And then as a follow-up to, as your point about, you can't really know who has what conditions that make wearing a mask sort of intentional for their health or safety. But, isn't there a number of people that, do you have really that many people in the business that are not wearing a mask? And that seems to make sense, or where's the line there in being able to enforce what you're sort of asking of other businesses?
Well, I think if we were in a place doing surveillance and nobody was wearing a mask, that would be extremely suspicious. When we've seen this situation, just think about it, if you're in the grocery store or other places, you see very few individuals that don't have a mask or a face covering on. And I would expect that to be the same situation in any bar, restaurant. We don't have a percentage number that we cut off. We have to have a point where we expect people to do the right thing and that they're going to do it.
And then just a technical question, maybe just for my own understanding. Is there a line in which the health department is advising people or businesses to not sort of question people who might not wear them because of a health reason? Is there a safety concern?
We have been.
Or a privacy concern, rather?
Yeah. Thanks for asking that question, Riley. I've meant to address that a few times. If an individual tells you that they have a medical situation and they're not able to wear a mask, we are not encouraging business owners or others to demand any kind of proof of that situation.
Question from Bill Kelly. Will the city be monitoring compliance of the Will Grove concert tonight?
My thought is we would be. I haven't, that one, I'm sorry, Bill, the name isn't just popping right up. But all events have to be monitored and approved, and we give guidance. So I would anticipate that that's been provided to them.
And also, could you clarify again, what are the ramifications for delayed testing results? What kinds of problems does that cause for you and your contactors?
I think the mayor outlined that really well in talking about what that does is, first of all, you have an individual who's probably employed somewhere and is not able to go to work. So it has an immediate impact on their economic stability. Then the other situation is when we get them so far out, by the time the individual gets their test results, they're already out of isolation and ready to go back. But we've missed all of those other people that they've had contact with who may now, who haven't been self-quarantining and may now be positive, and they're exposing others. So every case that exposes others is at least 3 more, and then it just keeps multiplying and multiplying. So it's a very serious concern to us.
Any other questions? All right. Thank you so much for tuning into this briefing. We appreciate all of your efforts to help keep our community safe and healthy, and we wish you all a very happy weekend.